Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. Bladder health is crucial to your overall health and quality of life. Yet at least 80% of the people living with MS experience bladder dysfunction. And bladder issues can often keep you from participating in daily activities at home and at work, and they can even have a negative effect on your self-esteem. Today, we're talking with physical therapist Valerie Block to understand what causes those bladder issues and how to manage and treat them. Dr. Block is an MS research fellow and an adjunct instructor at the University of California, San Francisco, in the Department of Physical Therapy and Rehabilitation Science and the UCSF Weill Institute for Neuroscience. Welcome, Dr. Block, and thank you for joining us today.
Thanks for having me, John.
You know, bladder function may not be everyone's favorite topic of conversation, but please tell us why it's important to talk about it.
So many of us don't really think about bladder function, John. It's actually somewhat unique in that way. So while it is regulated by the autonomic networks at the level of the spine, and babies are actually entirely under autonomic control, there is conscious awareness of bladder filling and then voluntary control of the process of micturition. As the bladder expands with increase in urine, it expands until you feel the urge to urinate. The sphincters hold it in until you find an adequate place to relieve yourself. Now, John, I'm sure all of us can think of a time when we really, really needed to go. But when the connections are not working properly, that need to go is really closely followed by a serious urgency to go, and potentially an accident if there are no restrooms close by. So having to constantly be aware of where the nearest restroom is, or not being able to jump up and down, play with your kids, cough for fear of leaking urine can really affect quality of life. And this can have knock-on effects on participation in physical activities, social interactions. This then affects mood and has actually had links to mild cognitive impairment and physical and mental fatigue, not to mention pain and frequent urinary tract infections.
Can you give us a quick overview of how a healthy bladder works and what causes those bladder issues to occur in people who are living with MS?
Sure. So it's pretty complicated, and I'll try and be succinct, but the bladder is lined by layers of muscle tissue that stretch and hold the urine. And these are called the detrusor muscles. And the normal capacity for a bladder is about 400 to 600 milliliters. During urination, the detrusor muscle squeezes, and the sphincters, the valves, open to allow urine to flow. Now, there are it's much more nuanced than this, and there's differences in gender, but that's the general idea. And then urine exits the bladder into the urethra and then carries the urine out of the body. Now, in MS, there are different reasons why the bladder might not work as it should. So usually this is due to MS lesions that block or delay the transmission of nerve signals in the area of the central nervous system that control the bladder or the urinary sphincters. So for instance, in MS, you can have the detrusor muscle contracting involuntarily. So when you don't want it to do, this increases the pressure in the bladder, decreases the volume available for the bladder that the bladder can hold, and can cause things like urinary frequency, urgency, leakage, and then nocturia, which is when people need to go to the loo multiple times a night.
What types of bladder problems can people with MS experience?
So depending on where the lesions are or where the issues are, you can have storage problems, which are probably the most common type of dysfunction. It's called overactive bladder. And this can include urgency, so needing to run to the restroom, as I was saying, increased frequency, so needing to go more than 5 times a day, nocturia, which is the name for when you have to wake up and go to the loo a lot at night, and then incontinence, which is the urinary leakage. And then there's a second type, which is when the bladder won't empty properly. And that can lead to hesitancy, so the delay in ability to urinate, and then retention, where the bladder doesn't fully evacuate all the urine.
And what are some of the most common symptoms that people should be aware of, the symptoms that are signs of potential bladder dysfunction? And I guess connected to that, when should someone speak to their healthcare team about it?
So I think any new urgency or an increase in frequency or nocturia, as I mentioned earlier, should be reported to your healthcare team. Also, if you feel like you're having difficulty emptying, so you don't feel like you fully empty your bladder every time you go, this can mean that urine stays in your bladder and can be a source of infection. So for UTIs, for instance.
You heard from Jason, and Jason is wondering if someone can experience more than one of these issues that you've described at the same time. He tells us he has problems with leaking, but also can't empty his bladder all the way.
Yes. So sadly, this is actually fairly common in people with MS. You can have both urge incontinence, which is the first issue he was describing, and hesitancy or incomplete bladder emptying, which was the second form.
We heard from Carly, who says she gets frequent urinary tract infections, or UTIs, but sometimes she doesn't even know she has one until she's very ill. What are the typical symptoms of a UTI?
So this can be quite tricky to define UTIs in people with MS, because the symptoms might not be what you consider a typical UTI symptom. So what we tend to go with is that it's really important to treat based on both urine cultures and symptoms, and not just based on positive cultures. It can be really nuanced and pretty difficult to figure out at times, but if you feel like there's something off, I would definitely speak to your healthcare team and try and get a urine culture.
For some people, talking about these issues with their healthcare provider can feel awkward and even embarrassing. Do you have any tips or suggestions for how to approach this kind of a conversation with your care team?
So John, you're right. It's not an easy subject to talk about. And I think that's one of the reasons why it tends to get to a stage where it's bad and affecting quality of life before people bring it up. I think it's going to take a lot of education on both sides of the table to reduce this taboo. So clinicians need to get more comfortable asking. And then on the other side, patients need to get more comfortable sharing. So it's really, really important to discuss any new symptoms with your provider early, because this actually gives us the best chance to intervene and treat bladder dysfunction at a stage when first-line treatments, non-invasive treatments like pelvic floor PTE are viable. Now, if you don't feel comfortable bringing this up with your neurologist, for instance, then I would suggest finding someone on your team that you do have a good rapport with. So it can be the nurse or the care manager, and start there and see what the best way is. And they can give you a specific advice, or how you can have a referral to a urology specialist, or again, a pelvic floor PT. I know it's a really sensitive subject, but it is so important to treat early. And I really encourage everyone that feels like they might have these issues to bring it up with their care team, because that's what we're here for, to help.
And what kind of impact can bladder dysfunction have on someone's life if they don't address those problems? What kinds of things could they be facing?
Well, sort of as I mentioned before, it can have a really big impact on physical activity. So if you feel like you're going to leak or you're not able to jump, then you don't do those physical activities. On mood, on intimacy, on fatigue, probably from lack of sleep if there's nocturia. And then the lower physical activity goes hand in hand with so many other things. So worse cardiovascular function, musculoskeletal function, psychosocial health, and that all really affects quality of life.
You know, bladder issues can usually be managed successfully with lifestyle modifications, medications, physical therapy, and/or even nerve stimulation procedures. So let's start with physical therapy, since it's usually a common recommendation and it happens to be your area of expertise. How can physical therapy help with bladder issues?
So actually, that was the first paper that I ever published. It was an evidence-based review on whether physical therapy interventions affect urinary incontinence and quality of life in people with MS. And I'll save you reading the long paper. Physical therapy can help reduce the number of leakage episodes and improve quality of life in people with MS. These interventions can include pelvic floor muscle training. So how to do a Kegel properly, but not only how to contract, but how to relax the pelvic floor properly. So it doesn't do us much good being able to contract this muscle if we don't also learn how to relax it, right? We can have neuromuscular electrical stimulation and electromyography biofeedback. These are both pelvic floor interventions that help teach patients to control voluntary muscle contraction through visual and auditory feedback. And we also have techniques for motor learning, for voluntary muscle techniques to achieve like the high session frequency that we want to get changes.
We heard from Grace, who does Kegel exercises to improve her pelvic floor muscles, but she's not sure if she's doing them correctly. And Grace is wondering whether you can explain the correct way to do those exercises.
It's quite tough to do on on a video, but I would suggest going to a pelvic floor PT, even if it's just for one session, so that you can get the training, get the hands-on of what a proper Kegel should look like or feel like. And while I don't really want to say that most people do Kegels wrong, I often find that most people could be more effective when they're doing them. So there are superficial layers, there are deep layers, and the difference in when you contract both of these is really important to a proper pelvic floor contraction. And then another important element is to make sure that the muscle overactivity or the increased tone isn't affecting the person's bladder function as well. So learning to do the Kegel as well as the relaxation is a really important tool. And then, sorry, one last thing I was going to say is just coordinating the Kegels with breathing patterns. So this can really improve the quality of movement. So doing respiratory diaphragmatic breathing while you do the pelvic floor contraction can really help as well.
Are there other exercises or activities that people can do at home to help strengthen muscles that may help with their bladder issues?
So there is a great study by Dr. Tootle, Laurie Tootle, and I can put the link in that if people are interested in looking at it. But strengthening the hip abductors and the external rotators has actually been shown to help increase pelvic floor muscle strength. I also tend to tell people to add abdominal and adductor strength exercises to their home program. And again, I'm happy to put some links in if people are interested.
So moving on from physical therapy treatment, what types of medications are available to help manage bladder dysfunction?
There are quite a few. There are anti-spasmodic medications that help control urgency, frequency, and leakage. There's Botox, which is what most people think of for wrinkles, but it's a neurotoxin that can help reduce spasticity when directly injected into the bladder. And this would be under local anesthesia by your urologist. And you do this every sort of 6 months. It's been approved by the FDA for decades. One of the issues with this, though, is that it can affect bladder emptying. So if you have that, what we were talking about, I think it was Jason that had asked that he has both types, then this might not be the most indicated. There are anticholinergic agents that are prescribed. However, these do have adverse effects, including constipation and dry mouth. And then incomplete voiding can also is also increased with the use of some of these drugs and exacerbating existing symptoms, which then results in low compliance.
We heard from Terrell, who said that he recently heard about an intervention called PTNS. Can you tell us what that stands for and what it is?
Sure. So PTNS is the percutaneous, so that going through the skin, tibial nerve stimulation. And this involves inserting a needle electrode into the ankle, and it sells signals to the bladder and pelvic floor muscle nerves, sorry. The treatments last for about 30 minutes, and you have to do it every week for around 12 weeks. And there's a lot of studies that show it can reduce urinary frequency. Now, a thing that another option for that would be transcutaneous tibial nerve stimulation, which is TTNS. And this just uses surface electrodes on the skin. So rather than needles, people can do this at home. And it's also been shown to have a high efficacy in reducing frequency, urgency, and incontinence in people with MS.
Audrey tells us that she was told by her MS specialist that she's not emptying her bladder completely and she may need to self-catheterize. She says she's not sure she'll be able to do this. So what advice or tips do you have for Audrey and others who are scared or at least reluctant to perform self-catheterization?
So for people that don't know, self-catheterization can be recommended for emptying the bladder. It's a small tube or catheter that's inserted into the urethra to help empty the bladder, and then it's removed. So it's not permanent for this one. It can be done 1 or more times a day to help control bladder leakage, urgency, frequency, and then nighttime urination. One of the urologists had a great way of putting it. She said, it's like brushing your teeth. If someone else were to brush your teeth, it would feel pretty weird. I have a 14-month-old. I try and brush his teeth. He won't let me. If you brush your own teeth, however, then it's not a big deal. So that's the same sort of concept with a catheter. You sort of get used to it and you know it will help.
You know, we've been discussing a lot of different treatments for bladder dysfunction. Are there 1 or 2 that you should be trying first, and then if they don't work, you move on to 3 and 4 perhaps? And can any of the treatments we've been discussing be used together?
So as I said, I think pelvic floor physical therapy should be the first line option. It is evidence-based that it does help. It has no drug interactions or side effects. You can use it with all your other MS drugs. And then if symptoms get worse, you can combine this with medications. And then depending on the type of bladder dysfunction, PTNS or TTNS, which is the percutaneous or the transcutaneous tibial nerve stimulation, and then maybe even bladder Botox.
In addition to these treatments, there are also practical tips that everyone can follow to help minimize the symptoms of bladder dysfunction. Can you share some of these strategies?
Sure. So the standard recommendations are to limit caffeine, so coffee, tea, soda, alcohol, All of those are bladder irritants and can increase bladder urgency. And then you can sip fluids gradually through the day instead of like guzzling huge amounts all at once. Timed voiding is one where you plan your restroom breaks every 1 to 3 hours to help prevent these urgent trips or leakages. And then wearing clothes that are easy to remove in a hurry. So if you're rushing to the restroom, you don't want to have to spend tons of time undoing buttons and zips and all the rest of it. Absorbent pads can be used if you're going for longer periods of time far away from a restroom. Adult diapers, washable underwear. And then, sometimes carrying a change of clothes as a backup can be helpful just to reduce that anxiety.
I know you're currently working on a National MS Society funded research project that's looking at new and accessible treatments for bladder dysfunction among people with MS. Tell me, what do you hope to learn from this research?
Yes, so I'm so excited to be starting this project, and we have two main aims. The first is to look at a really beautiful, large, longitudinal data set that we have with information about MS symptoms like fatigue, bladder, mood, quality of life, pain, etc. We also have some remotely collected physical activity data, as well as MRIs and other demographic outcomes. And so what we'll do is use these to determine who is at risk of developing bladder dysfunction. So characterizing the prevalence of bladder dysfunction with certain people. And hopefully we can flag, in this way, we can flag people early and intervene early before symptoms start, or at stages when, as I said, the non-invasive therapies can make a difference. And then our second goal is to combine new technological tools to monitor and then treat bladder dysfunction in the home setting. So we'll use tools that are on the market already, so biosensors or neurostimulation, and we'll create wearables for the bladder toolkit. And while many of these technologies exist commercially, they haven't been tested in people with MS, either alone or in combination. And so our goal for this part of the study is to understand whether they're acceptable for intended users, clinicians and patients, and then being able to follow patients in a sustained way and learning how they're actually doing in everyday life can help us understand how bothersome their bladder symptoms are. And then for the second part, for treatment, being able to treat patients using these tools in combination with the telehealth or televideo visits can overcome some of the barriers that people face getting routine in-clinic treatments for their bladder symptoms.
So tell me, how could some of the work you've just described, this project you're currently involved in, how could it impact people's lives?
So remember when I said earlier that one of the standard recommendations was timed voiding, right? Well, that's not very fun. People with MS want to live their lives. They don't want to have a clock telling them to go to the restroom every 2 hours. So hopefully with these tools, what we'll be able to do is provide devices that can, for instance, tell you how full your bladder is by Bluetooth to your phone. And then this will allow the user to plan their outings, plan their exercise, their restroom breaks in a more kind of autonomous, personalized way. And this pilot study will pave the way for much larger trials, implementing these pilot changes in our MS clinic. Our first aim to develop the tool to detect the early warning signs will allow us to identify people at risk of bladder dysfunction and progression, and improve on the current methods we have to classify and detect bladder dysfunction worsening. People with MS can be enrolled in early treatments and prevention trials, which at the moment isn't really a possibility. And then next, when we determine which remote measures and treatment for bladder dysfunction might be most promising, we can provide researchers with home-based testing and treatment toolkits that can be used to improve adherence of treatments, because it's not that fun to have to go into the clinic, 3 times a week for a treatment when you have your normal physical therapy and you have your psychologist and your neurologist and your urologist. There's many, many different competing times. So being able to do this at home will be a real benefit to increasing the dosage, the frequency, and the intensity of this data. And it will give us a more realistic picture of how people are doing in their home, and then be able to treat in a closed loop fashion. So not, we'll give you an exercise, you go away for a month, and then you come back and we're like, oh, you haven't done it right. We have to start all over again. So hopefully that'll help.
Well, thank you for sharing some important information about a subject that not everyone is comfortable talking about, but I think you've certainly reminded us about how important it is to talk about it with your MS care team. Let me ask you, what would you say are the top 3 takeaways that you'd like our viewers to remember?
So I think, first of all, share your bladder concerns with your care team early. You're not alone. 85% of people with MS do suffer from some bladder dysfunction over the course of the disease. And we have people and tools that can help. I think the second one would be to see a pelvic floor PT. Even if you're okay and you're managing right now, they really do have a lot of wisdom about tools that can help you navigate the symptom and prevent any progression. And the American Physical Therapy Association, if you go to find a PT and you put your zip code in, can help you find a pelvic floor PT in your area. And then the third one would be do Kegels, but make sure that you are not only doing the contraction phase, but also the relaxation phase.
Well, I want to thank everyone who submitted questions, and thank you for being with us today, Dr. Block.
Thank you so much.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll hear about ways that you can get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Block for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webinars. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Valerie Block and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.